Oh, nice and loud. Okay, welcome everybody. I should actually, okay, I'm gonna bring something to make it higher. Welcome everybody. We are here tonight for yet another, there we go, Living Chassidus Life Skills series. And we are so lucky to have today an incredible speaker. I want to also mention that tonight's event is schos for Refuah Shalema for a friend of childhood. I used to actually babysit him, and now he's a big boy and he should have Refuah Shalema. His name is Yaakov Yosef Ben Hadaya Marta. He should have Refuah Shalema, and the entire family should be blessed with only good and revealed good. Amen. And I want to thank every single one of you who is here in person, and thank every single one of you who is here on Zoom. And we're very lucky to be here together. So tonight's topic is something I've been wanting to bring to Living Chassidus for a very long time, because I feel that we cover a lot of amazing topics, and the whole point of our life skill series is that we should give you guys the life skills, that way you don't get to life and say, I wish somebody would have told me. So here we are telling you. And so much of my life is spent using naturopathic home remedies. I have an interesting upbringing. One of my parents is a doctor, medical doctor, and one of my parents is a more natural minded, she was a psychologist, but she always had like natural stuff. So I always got both, and I wanted to go into medicine. So I spent a lot of time building my medical knowledge, pre-med and all that stuff. So once I found that there are so many things in our own homes, in our own lives, that can bring us solutions, that can bring us relief, that we don't have to constantly be going. And as we wrote in the introduction, that you don't have to necessarily run to the pharmacy to find something that was made. It's already in your house or in your backyard or in your whatever. So the moment I met Ivy, I said, okay, this is something we need to bring to Living Chassidus. She has incredible tons of topics, and we hope to bring her up again soon, but this is the one that we're covering tonight. So I'm going to now introduce her incredible background. So Dr. Ivy, how do you say your last name? Branin is a naturopathic doctor and founder of Simplicity Health Associates located in New York City. Dr. Ivy received her degree in naturopathic medicine from
Castor. A lot of hard work.
Yes. Castor University. She received her bachelor's degree in biochemical engineering with a minor in French from Rutgers University. That one I got. She specializes in mood disorders, women's health and hormonal imbalances, acne, and gastrointestinal conditions. You can find her on her website and simplicityhealthassociates.com, or on Instagram at Dr. Ivy Branin, or on Facebook at Dr. Ivy ND, right?
Yes.
Beautiful.
Perfect.
Yay. And now I'm gonna bring something to lift it higher, but I pass the baton on to you.
Okay. I guess the big question is, how much can you see the presentation?
Okay, let me work on that.
Okay.
And then I'm gonna click here. Sorry, where's my mouse? There we go. Okay, so you should be perfect.
So it's here. Okay. So thank you everyone for coming, and thank you so much, Michal, for having me speak. And I'm really excited about this topic. And one of the things is this presentation, we're really just scratching the surface. There's so many
Okay, you know what? I'm gonna just switch. Let me switch the setup for a second. Let me just switch the setup. Technical difficulties.
Yeah. Okay, that might be first.
And it's much clearer. Is that better?
Yes, that's better.
Okay, now I'm gonna move this over here. And this closer to you. Is that?
Yes. So I don't know
That's
something.
We're getting there. We're getting there. Live and learn, guys. Live and learn. Maybe we'll switch. Oh, you know what?
That's the computer. Really? The laptop. The shadow of the laptop. Yeah, that's better.
Better. Even better. Let's just do one more. Sorry, everybody. Just how life works.
Yeah.
There we
Way
go.
better.
Okay.
Yay.
Got it.
Okay. That's it.
Okay, so as I was saying, that this is like really just scratching the surface. There's so many really great natural remedies I could have chosen tonight, but I wanted to choose a selection, both from ones that I use most commonly in my practice, but I also wanted to make sure that I included many that you could easily access just from basic things that you have in your home. Okay. There we go. So I always start these presentations just talking a little bit about naturopathic medicine, mostly because most people have never heard of it. I actually didn't even know what it was until I think it was like about 2 years before I started studying. So it's not very commonly known. So naturopathic medicine is this patient-specific system of medicine which utilizes natural therapies to stimulate the body's own healing potential. And I think the biggest part about naturopathic medicine is our 6 guiding principles. And just to highlight a few, kind of like thinking about like tonight's presentation. So because this is a presentation and I'm trying to teach you, doctor as teacher, I definitely think is one of the really important, one of the principles. And then really focusing a lot on this healing power of nature. And so one of the things is that our bodies have intelligence. Even when we're in pain, it's basically our body is telling us that there's something wrong that needs to be addressed. And so really thinking about this idea around the healing power of nature. So the first set of remedies, and so each of the slides, I have like a different, one of my favorite plants associated with the topic. And so this picture right here is mullein, and it's probably one of our best. I'm not going to be talking so much about herbs tonight, though I will be talking about some herbs. Mullein is just a great all-purpose cold and flu herb because all the parts of the plant have different mechanisms when it comes to immune support and also helping with cough. Although I'm not going to talk so much about that herb, but I just wanted to point out the different herbs as we go along. So our first home remedy is onion earmuffs. So what are we talking about here? So onion earmuffs are very, very therapeutic when it comes to ear infections. So definitely if we're thinking about if we have children, even adults. And so how onion works as a treatment for ear infection is one, onion is very high in a phytonutrient called quercetin, which we might be familiar with. And quercetin is very anti-inflammatory. Another reason why onion earmuffs are good for ear infections is that they are able to draw fluid. So when we think about one of the reasons why ear infections cause so much pain is due to the buildup of fluid, which causes a lot of pressure. And then lastly, because onion, which is also in the same family as garlic, is very high in sulfur compounds. These sulfur compounds are very antibacterial. So how does onion earmuffs work? So it's a pretty simple procedure. All you do is you cut onion in half in the oven for about a half a minute to a minute. Often you want to cover it. Oh, thank you. Sure. You want to cover it in some cloth, either cotton or wool, and you place it on the ear. It should be warm. It shouldn't be hot because obviously if you're working with an infant, you don't want to burn the infant. So it should just be warm. And you want to basically put it on the affected ear for about 10 minutes. You might have to reapply 3 to 4 times a day, but it can be very, very effective. Both, it even has the ability to even help sometimes prevent ear infection. So that's a great one. Because actually, believe it or not, the studies really show that antibiotics are not that effective when it comes to ear infections. In fact, actually, they can actually promote recurrence of ear infection. And then there's been awful studies when it comes to another thing that they'll sometimes do when it comes to recurrent ear infection is there's a tubal procedure that also has been shown to be not that effective. So onion earmuffs, great tool to know. Okay, so another cold and flu remedy is a mustard pack. And this again should be something that we can all find in our homes. And so mustard is a very warming herb. It also has a lot of antimicrobial, antibacterial properties. But the big thing that a mustard pack is indicated for is dry cough, specifically when we're thinking about coughs where there's a lot of mucus stagnation. And that's basically what the mustard pack is doing. It's helping to loosen up mucus. So if you have somebody who's like really having a hard time like with breathing, so this could be a really effective method. So how does it work? So you take about 1 to 2 tablespoons of dried mustard powder, where you can get it like most stores, you might even have it in your house. You mix it with a cup of regular white all-purpose flour, then add a little bit of warm water, maybe like a few tablespoons at a time, just to make a thick paste. Then to make the pack, so you take this paste, you either want to put it on cotton or wool, basically an all natural fiber. So you kind of create this pack. You put the cloth side on, so on your patient, your child, you, your friend, you put the cloth side on the chest with the mustard side up, then apply another piece of like a saran wrap or a plastic wrap, and then a heating element. Now for adults, the recommendation is no more than 20 minutes. And then for children would be no more than 10 minutes. But this can be really specifically somebody's having a lot of hard time like breathing, like a rattling cough. This can really help to expel some of the mucus. So warming sock treatment. This is like one of the first remedies I learned in naturopathic school. It's also called wet sock treatment. But one of my professors said that we should call it warming sock treatment because it sounds a lot nicer than a wet sock treatment, though it's technically the same thing. So this procedure is, again, we're thinking about, so this can be really good for head cold, congestion, any kind of like flu that's just like lingering. And the way that it works is basically it helps to actually mount a fever in a safe way. So we actually sometimes do want a fever to mount to basically expel out whatever the virus, the bacteria that we're working with. And so the procedure, so you're going to have to get so a couple of things that you're going to need. You're going to need a pair of cotton socks, a pair of wool socks, ideally a wool blanket. And so how the procedure works is, so either yourself or the patient, your friend, your loved one, whoever is having the illness, first, you would have them either take a hot bath or a hot shower while you prepare everything else. So what are you preparing? So you're going to take a pair of ideally cotton socks. So you really don't want synthetic, any kind of synthetic material. So you take those cotton socks, you get them wet, then you wring them out, like getting all the excess. You stick them actually in the freezer until they're stiff. I actually have a video on this, and it's like really funny. Stiff. So after your friend, your patient, they've taken their hot shower, their hot bath, you take the socks from the freezer, you put them on them. Then you put a pair of wool socks, and then ideally you want to do this either before they, like when they would go to bed anyway. And then you have them go into the bed, ideally with, very warm blanket, ideally wool. The effect, not only does it help to really dispel the cold, specifically a head cold, it also has a secondary sedating effect. And so if we also think about when you're sick, sleep, and rest, and flow is really your best medicine. And so that's going to also really help the patient relax. I mean, yes, the initial shock of the cold socks.
I was going to say, like, how do you get past that?
But it's kind of a very remarkable treatment. Children will respond very, very well. Actually, most of the remedies I'm talking about today, mostly children just tend to respond well.
Wow.
So this is another good one to have, like in your toolkit. And again, like all these things are typically stuff that we can find lying around the house. Okay, so moving on to women's health. So my area of specialty is women's health. So I had to at least have a couple women's health remedies. And as I was saying before, so this herb right here is Vitex, which is, or also called chase tree berry. Again, I'm not getting so much into the herbs, but this is a really one of my favorite all-purpose women's herb for a variety of different health concerns. Okay, so the first remedy is castor oil pack. And so castor oil, some of us might know of it as something that maybe actually no one here from this generation, not my generation either. Castor oil was used internally as a laxative, and sometimes people still use that. It's also, if there's anybody here who's either thinking about becoming a midwife or a doula, so castor oil can also be used to promote labor when a woman is going past term. I'm not talking about those usages today. I'm talking about it as a topical that is really, really, this is probably one of my favorite female remedies. What do I use it for? So I see a lot of fibroids in my practice. So it's very good for fibroids, very good for painful, heavy periods, endometriosis. And then it actually even has like other more like gastrointestinal applications. So sorry.
Just for anyone who doesn't know, can you explain fibroids?
Oh, sure. So fibroids are basically growths that happen in the uterus. They can happen either in the wall of the uterus, outside the uterus. And the main issues that they cause are typically heavy, painful periods. They can also cause, depending on the size, there's different theories on why they occur. Mostly we know them as either due to hormonal imbalances where you're going to have more estrogen, or periods of very high inflammation. And there's also different theories of where this inflammation is coming from. And then also issues around detoxification. And so these growths, also if they can get so large, they can also cause bladder issues like frequent urination or incontinence. And in some cases, depending on where the fibroid is, it can cause fertility challenges. It doesn't cause infertility, I like to say, it causes fertility challenges. And so sometimes the fibroids have to be removed before a woman would be able to conceive. So these are growths that can, and then the other thing that a lot of my female patients, their dresses don't fit so great around their waist, and by shrinking them can really help a lot. So castor oil packs are really good.
They drink it or is it?
I'm gonna give a little background, and then I'll talk about how we do castor oil packs. And then they also, again, can be used also for constipation or abdominal distress. And so the way that they work because one, they really do decrease inflammation. They also really help to aid in detoxification. And so the method, so basically you take either typically a flannel piece of cloth and you saturate it with the castor oil, you wring it out. So one thing to note about castor oil, it is super sticky, very, very sticky. And I learned this the hard way. So because it's very, very anti-inflammatory. And when I was in naturopathic school, I had some kind of injury or something. And I was like, oh, I'll use castor oil, I'll put it on my leg, I'll go to bed. It was so bad because it's like so sticky. It was like sticking to my sheets. It was a nightmare. So it is a pretty messy procedure. I have trained my patients to make it less and less messy. So I'll talk about sort of like the basics, and then I'll tell you maybe my shortcut. So you saturate the cloth, you wring it out, and then you want to so I actually think the best is taking, if you get like a trash bag, and cutting it and putting it on. So basically you're going to put it from your like breastbone, like under your like your bra strap or your breastbone up into your pubic bone. And so usually we'll have the patient put the trash bag, or you can also do like a saran wrap or any kind of bag, like a plastic, and you put the 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 flannel on top, and then you want to put another layer of some kind of plastic, and then you put some sort of heating element, whether it's a heating pad or a hot water bottle. And ideally you want to do it for about 30 to 45 minutes. With most patients, I'm recommending to do it about 4 to 5 times a week, depending on what we're using it for. And again, because it is super sticky, and you make sure like you don't, you might want to also like lay on a towel, but again, you should be wringing out really good. And that's one mistake that sometimes patients make, is like not wringing it out enough, because you can actually reuse the pack that you make. You can probably reuse it about 3 to 4 times. And the reason I like doing the garbage bag method is basically it actually makes it pretty neat. So then when you're done, you can actually just like fold it in half, like once and then twice, and then you put it in a Ziploc bag.
So what, you rub the cream or the oil on the material and then put it on it?
Exactly. Oh, and also I am, if people are interested, I can also email them. I'll email you all the different steps with every single thing that I'm recommending, because it's a
So I don't
lot.
have to write down all the steps.
You can if you want.
Just some questions, just to make, so first, so that the castor oil doesn't actually touch your body,
Exactly.
and it has a healing effect even through the plastic.
Yes.
Wow.
Yeah, that's like that powerful. Yeah, castor oil is like great
So
medicine.
you can't put it directly in your body, like on your skin.
You could, yeah, you can. She's just trying to say so messy.
Yeah,
It's the
sticky,
messiest thing ever. My goodness. It's like this after like that experience. So like when I was in naturopathic school, I was all about like experimenting on myself all the time. I did some crazy things. That was one of them. Okay, so seed cycling. So seed cycling is probably one of my favorite things, and probably something that I recommend the most. So seed cycling works with 4 different types of seeds: flax, pumpkin, sesame, and sunflower seed. And the idea is that they mimic our 2 major hormones of the menstrual cycle, one being estrogen and the other being progesterone. I have on the other side, so this is like how all like the interplay of hormones and how that relates to your cycle and ovulation. But really just the thing that you really need to know is that the first half of your cycle, which is also called the follicular phase, is dominated by estrogen. And then the second half of your cycle, which is also called the luteal phase, is dominated by progesterone. And so the basic idea is that by taking estrogen promoting seeds, typically along with fish oil, at the beginning half of your cycle, and those are flaxseed and pumpkin seed, and then taking progesterone rich seeds, which are the pumpkin seed and the sesame seed. And I usually will balance that out with evening primrose oil at the second half of the cycle. What that does is, well, one, I use this seed cycling for a couple of different applications. I do use it for women that are not getting their cycle. And I have found that it works really, really well. I will usually do a couple other things because there can be other issues at play, but it can really help with a woman who is not getting her cycle. It also can help with women whose cycle is all over the place. Again, there's usually other things that I'm doing too, but this is something that I really help with. Also with women that might have been on hormonal birth control, I find that this is a really good for them who are wanting to get off. And then the other thing that, so because I do work a lot with fertility, it really does help to support very healthy ovulation, which is really important, because if we don't have healthy ovulation, we aren't going to conceive. So it's a really, really helpful. It also helps with, again, because you're really balancing the hormones. It's actually one of the things I find is no matter whether it's like an imbalance between estrogen or progesterone, it seems to always work. And so I will usually this will usually be my first go-to, specifically if I haven't gotten the chance to run any labs on the patient. When it comes to herbs to support estrogen and progesterone, I usually tend to only recommend those when we've actually seen what the blood work looks like. But this tends to always just really help to even out the cycle. It's also very helpful when it comes to like how I was talking before, but conditions like endometriosis or polycystic ovarian syndrome. But it's like one of my favorite things to do. It also, a funny application of seed cycling is for women that want to change the date of their cycle. I've had women, whether it's like they're going on their honeymoon or they're going on vacation and they just don't, or they're getting married. There's like all the reasons where.
I'm sure you haven't thought of that.
Right. So there's a lot of reasons why women might not want to get their period or they want to delay it. And so seed cycling can work, though. If you are going to use seed cycling to move your cycle, you really have to work at least 3 to 4 months in advance for it to work. It's not something that's going to shift your cycle over, but I have seen it work. And it's pretty remarkable because then, from the conventional medical model, they would typically use birth control pills to move it. But this is a way that's a lot more natural and non-harmful. Okay, then alternating sitz baths. So alternating sitz bath is really, really good for whenever anything involving the pelvis. So again, if we're thinking about things like fibroids, also postpartum care. It doesn't even have to be just for women's health concerns, hemorrhoids, any kind of bladder irritation, infection, basically anything where there's congestion happening in the pelvis. And and when we mean alternating, what we mean is alternating between hot and cold. And we actually use this application, not just in sitz baths, but we use this alternating hot and cold in so many other types of treatments within naturopathic medicine. And the reason doing hot and cold is it really helps to promote circulation. So whether you're doing alternating sitz bath or a contrast shower, the typical pattern is always start on hot and end on cold. And we'll usually have the patient do anywhere from like 3 to 4 cycles. Typically, you would do hot longer than cold because cold can be very shocking. And there's like different I guess like theories whether or not it has to be so like very, very hot to like freezing ice cold or just nice and warm to like room temp. So there's different theories about which would be better. And then when it comes to sitz baths, you can buy what's called a sitz bath in like a drugstore, but you can easily just use a basin. Another thing that you can also do with this sitz bath is adding different herbs, whether you're adding essential oils. I personally really like calendula is a really good healing herb, which is not too hard to find. Chamomile could be really therapeutic. And so this can be really helpful whenever you're dealing with any kind of like condition that involves like pelvic stagnation.
I've heard it's being said that you're kind of sitting in a cup of tea.
Yeah. And then like another alternate, like there's so many other workarounds too. Like you can also take towels and like dampen towels if for some reason you don't have, so there's different ways that you could do this sitz bath, but usually we recommend just doing the basin. Okay, so wound healing. And so this herb is a really good healing herb. This is actually comfrey, which is also called symphytum. Very amazing healing herb. Definitely want to look that up. Okay, so Veggie Poultices. And actually, you don't even just have to use vegetables for poultices, but I decided just to focus on veggies because most of us have hopefully some carrots and onions and potatoes lying around. So poultices are like one of our oldest forms of medicine. And basically what a poultice is, and because if we think about like before we had like such great extraction methods, so poultice is basically finely chopping up some sort of plant to make a paste and applying it to the body. Why these can be really helpful for wound healing is, again, it's back to this whole idea around drawing. So drawing fluid, specifically when we think about things like abscesses or cysts. And I know I don't know if anyone here is, but like I know that like I've been to some of the living Histitis things, and it seems like there's a lot of women who are either interested in becoming doulas or midwives. And so I also tried to pick ones that I thought would be kind of very applicable. So vegetable poultices, specifically either carrot or potato, can be really helpful with mastitis. So mastitis is when a woman is breastfeeding and she develops painful breasts. And so this can be really good application of a poultice. And I see a head shaking, so I feel like
help tons of people with it.
yeah. And so typically when it comes to poultices, so you're usually very often it is recommended to cook the vegetable. You do want to apply, it's again another application where you want to apply some heat, not too much heat, but definitely have some heat. So whether it's you're applying it already warm, and then, typically about like 10 to 15 minutes, you might have to do multiple applications during the day. Another type of poultice outside like the veg. Oh, sure.
Pro tip on that?
Yeah, of
Peel
course.
the potato, because the skin stains your clothes.
Ah, that's smart. It's very, very smart. Yeah.
Do warm poultice and then ice pack and then warm poultice. And
Oh, that's brilliant. That's really smart. Yeah.
really well.
Yeah. So something else. I mean, they're also good for bug bites, sunburn. Poultices are really, really good. Another type of poultice. So basically, poultice is just making a paste, typically out of plant. Right. So it's, and you can use you can put it in a food processor or just chop it up, grate it. You could even take, again, you can even take like a cheesecloth or a piece of cloth and just kind of like make one of those, almost like those, like when you go to a fancy restaurant and they have like that little, like the thing with the lemon. Another type of poultice, which I really like, has anyone heard of bentonite clay?
Oh, what color is that one?
It's like a gray. So sometimes people drink bentonite clay as a detoxificant, but
With the vegetables, do you cook them or they're raw?
typically usually cook them. Yeah, you can also use it raw. You can also use it raw too. Yeah, raw or cooked. But bentonite clay is really good, very, very drying. I think you can probably get it on Amazon. One of my favorite remedies specifically for bug bites is taking equal parts bentonite clay and golden seal, and you can even just get like the golden seal like capsules and open them up, and you make a paste and apply that to the bug bite. It really helps to neutralize the sting. Very, very, very good to know.
What's golden seal?
So golden seal has a lot of different properties. It comes from a plant called golden seal. And its main active constituent is called berberine, which I think is really it's like one of the up and coming very popular supplements right now. But it's very strong antimicrobial. I mean, yeah, golden seal is a really good herb to have. Some people are not so into it right now because it's been over harvested. So an alternative would be Oregon grape. They're both in the same family, but you should be able to find them pretty easily.
What form? Like powder?
Yeah, the powder. Oh, to make the paste?
Yes.
Yeah,
because
just
I
the
have
powder.
terrible bug bites. So
Yeah,
so I'm like.
Yeah. So yeah, just equal parts, both powder. So if you did like a teaspoon of the bentonite, do a teaspoon of the golden seal, mix it with just like enough water just to make a paste. This is another stainer. Hate to say it. A lot of naturopathic remedies stain your clothes. So it's bright yellow. So just something to keep in mind. It definitely stains.
Just buy bright yellow clothing.
Right.
Really?
Okay, so general wellness. So another one of my favorite herbs. This is milk thistle, which is really supportive for. Yeah, isn't it beautiful? Yeah, it's beautiful.
We've heard about it before.
Yeah, it's a pretty common. Feels like a pretty well-known herb. It has a lot of. I mean, the biggest thing is for liver support.
Yep.
We took a lot of milk thistle, specifically my first year in naturopathic school, because believe it or not, we did have cadaver lab. And so we were basically had to spend like 2 to 3 hours a week in formaldehyde. So you can imagine how awful that is. So milk thistle is really a good one to have. So for general wellness, I really like dry brushing. This is also called just skin brushing or lymphatic brushing. And so one of the interesting things is actually the largest organ in the body is our skin. And it's also our largest organ of detoxification. So it's not just all about the liver and the colon and the kidneys, but our skin is a really big organ of detoxification. And so what dry brushing does, it does a couple of things. One, it helps to remove dead skin cells, which is going to just help our pores naturally breathe. It also helps to stimulate the lymphatic system. And basically we can kind of just think of the lymphatic system as like the garbage collector of our body. And so it helps to stimulate the lymphatic system, which is also important when it comes to the movement of fluid, also our stimulating our immune system. Also, it helps with circulation and also things like helping with tone. And so how dry brushing works is it works with specific regions of the body. And basically what we're doing is we're focusing on the different regions or our different regions of lymph nodes. And it does have, it's not like a haphazard thing if you do it. It is something that actually has an order. So most of the regions of the body, when you're doing it, you do 7 strokes. There are some areas that are a little bit different, and you always start with the left. And so the first region that we work with is the axillary region, also known as armpit, because we have a lot of lymph nodes here. And so one of the other things is that you're always going towards the lymph node, because basically the idea is that you're really trying to drain into the lymph node. And so there's a specific order. So typically, yeah, you go from, first is the axillary region where you're moving from kind of like around the sternum towards the armpit. And then you end up going, then you go like around and over, and then you go back. And so each of those would be 7 strokes. Then you go from your elbow to the armpit, also 7 strokes. Then wrist to elbow, 7 strokes. Then you do palm of hand, then you do dorsum. Then you go from the base of the skull to the sternum, 7 strokes. Then here, 7 strokes. Then you do your abdomen. And so with the abdomen, we start at the belly button, also the umbilicus, and we basically are moving kind of like in this concentric pattern outward. Then you go to the groin area first, doing circular motion. Then from the knee to the groin this way. Then it's very similar, ankle to the knee. And then you do the sole of your foot in the circular pattern. Then you do the dorsum, or the top of the foot, from the toes to the ankle, and then around the ankle. And then lastly, you finish on the back. And I know that's a lot of repetition. It should, after you've mastered it, like after you've done it a few times, it really shouldn't take more than 2 to 5 minutes of practice. But it, you know, after
half an hour.
No, it does sound like a lot, because you're doing like quick strokes. And so again, you always start on the left, you finish on the right. Typically it's usually about 7 strokes. And I also, like, again, in the handout, I have all the different regions of the body. If you want to do the practice, I definitely recommend doing it like anywhere from like 4 to 5 times a week, or if you're able to do it daily. I like dry brushing particularly because one of my favorite detoxification methods is actually sauna. But how many of us always have access to a sauna? It could be really amazing if we all could do a sauna anywhere. Right. Yeah. So
Exactly.
Right. Yeah. So this is a really great one because, again, like pretty low tech. Also, if you're somebody who does not want to get really hot and does not like heat, so this is a really great detoxification tool to have
So just to clarify, you do the full side left side, and then you do the full side right side?
Right, with the middle parts in the middle, which is basically the abdomen and then the lower back.
So, and then you finish off with the abdomen in the middle left, or you?
So you do like the whole the left sides, and you do the abdomen, back, and then you repeat on the right side. Yeah.
So you use a brush for the time.
Yeah, yeah, and
Do they sell specific brushes?
oh yeah, you can find them anywhere. I probably should have brought one with me tonight.
They look like that.
Yeah, yeah. So basically, they just look like that.
How would you search for it?
Oh, you can like every single. They probably have it at, but
Just
probably.
a dry brush?
I think they probably even have it at like any of the pharmacies on
Oh, yeah?
Kingston. Maybe it's
Yeah.
not that, or you can always buy it on
Amazon.
Amazon. You can buy everything on Amazon
Yeah.
for sure. And definitely, I'd say too, like when you're newer to the, it's gonna feel really scratchy, so you want to be careful with the pressure. Not that it would really cause harm, it just isn't gonna feel really good. And then usually we recommend taking a shower after to like remove any of like the dead skin cells.
Do you brush with oil or put oil on after or before? Or that?
And I mean, I've never done that. I've never recommended that. Yeah, I don't really see what the benefit would be. I mean, you could, I would say if anything, do the brushing, take the shower, and then if you wanted to apply any kind of right or oil. I'm just even wondering because even like, because if you think about it, like if you're scratching, you are causing a little bit of irritation. So I'd also say that if you were going to apply any kind of oil or lotion, make sure that you have used it before and you don't have like any kind of like allergy to it. Yeah, which actually reminds me that I'd say like the only, well, obvious contraindication is if you have like a cut or something, you don't want to be doing dry brushing, but there is a type of dermatitis that actually, which is like a rash or like a eczema that does get brought on by scratching. So if you find yourself, if you do this and you're getting rashes, then this might not be a good method for you.
Is there anything for like acne and scars and scabs?
Oh, okay. So that
She's like, yes, there is. I wasn't prepared to speak about it.
there's I mean, there's a lot of different things that one can do. So I would say definitely when it comes.
Maybe repeat the question.
Okay, so the question was, are there things that can be done for acne scars? Okay, so I would
Acne and or scars.
acne scars. So acne, I would say, is very, very treatable from a naturopathic standpoint. And it's a very individual, I'll just say, just to kind of give you an idea. So it's a very individualized approach. So there's different causes of acne. I mean, the most common cause of acne is hormonal imbalances. So you really need to treat the hormonal imbalances. Other things that also can be a factor are different food sensitivities, gut health, stress. And then sometimes it can just be as simple as hygiene tweaks. And so typically I usually would say with a patient, it's all about like determining where are the causes and then thinking about it, probably take about like anywhere from 3 to 6 months to achieve clear skin once those things are in order. Then when it comes to acne scars, so typically with patients, I don't even really start addressing acne scars until we have the patient stop breaking out. There are a couple of natural remedies, but I'll have to be honest as far as, because a lot of time, I guess it's just what I'm used to in my practice. A lot of my patients want to get rid of the acne scars faster. And so usually I will recommend things like microneedling or doing some chemical peels. Those seem to be very effective, but I would never recommend,
What's microneedling?
So microneedling, it's almost exactly how it sounds. It's like these little needles that do help with the regeneration of collagen, and they can actually correct acne scarring, but that you would not want to do that if you are still breaking out. That's something very like, and also with either one, because I tend to like, I have like a lot of like brides or brides to be in my practice. And so these kinds of things you always want to kind of consider, specifically with the chemical peels, because you are going to have a lot of residual redness for a while. And then also with the chemical peels, you have to be careful when it comes to sun exposure. So I'm always kind of like counseling my patients through that. But, from if you wanted to do something more natural, there are some really good herbs to use, but it just would probably take a bit longer. Probably one of my favorite well, actually, one of them I already showed, which is Comfrey, also known as Symphytum, calendula, and then also go-to cola are really good. So I would do it topically, but again,
translate topic. Not everybody may.
Yeah, topically, yeah. But again, it depends on what kind of results and the timeline of the patient.
Does vitamin E oil, is that enough?
Vitamin E oil can help, but yeah, scarring is always depending also the kind of scar versus because you have the pigmentation scarring versus the indentation. So I'd say really honestly with the indentation, you really do need to do something like microneedling or a chemical peel versus if it's a pigmentation issue, that does tend to respond pretty well to things, just as you said, vitamin E oil. Vitamin E oil is an amazing thing, and I have seen it work. If on another wound healing, I had a patient a few years ago. She was cooking kale, and oil splashed in her face.
Oh,
Yes, exactly. And vitamin E oil.
it's sticky, does that make sense? That vitamin E oil is
It's like a little sticky, yeah.
And if it's mixed, someone told me, is it okay that it's mixed with lavender? It's not that
Mixed with what?
lavender.
Well, it depends where you're using it for. It can be fine, yeah. Again, with everything, I'd say, so overall, most herbs are safe, but everyone might have an allergy. So I'd say nothing is universally safe for everyone. So for most patients are okay with lavender. And I'm actually going to talk a little bit about lavender because it's my favorite herb.
I have a brother that's sensitive to lavender.
Yeah.
Puts lavender and he breaks out, but everyone else in my family uses it all the time for everything.
Right.
So
Now,
there's
yeah, I've been amazed sometimes at the things that I have to change for certain patients. I always look at that outlier patient that's allergic to something as basic as chamomile. And then it's such a nightmare because specifically something like chamomile, because when it comes to digestive formulas, almost every single digestive formula has chamomile in it. And so I've really had to do some really coming up with new ideas. Okay, so now I'm going to talk about 4 herbs, and I picked 4 herbs that I thought, again, were pretty easy to get and that I thought also had a lot of good healing properties. Chamomile, there we go. So chamomile is a really great herb. And so a couple of things about chamomile. One, it's really good for digestion. It's both what we call a carminative. So carminatives are herbs that really ease digestion, but it also is a bitter, and I'll talk about how I utilize chamomile to access that bitter quality. So bitters are really important for digestion because they stimulate digestion. So whenever there's any kind of acid reflux or indigestion, we call it dyspepsia, bitter herbs are really good. Chamomile is also very anti-inflammatory, also has antibacterial products and properties. And I'm just going to actually talk about chamomile as the basic chamomile you find. Probably we all have chamomile in our cupboard, whether somebody gave it to us or whatever. So plain Jane regular chamomile tea bags, lots of really great usages. Now, of course, there's definitely better brands than others. My typical favorite, when I'm using herbs for a medicinal property, would be traditional medicinals because they're very clean. They don't put any weird additives. They're just very, very basic. They're all organic, and I just really like that company. So when I'm using chamomile, again, if you are feeling nauseous or you're having a lot of indigestion, I will have patients do what I call a very strong chamomile, because one of the things I want to really access is more the bitter properties that you're not going to get if you're just steeping it in a normal way. And so what I'll have patients do is take 2 bags instead of 1, and I'll have them steep it for about 20 minutes and take that before each meal. And I find like that can be really good. It also, one of the things I do use a lot in my practice are tinctures, which are an alcohol preparation of herbs, but not everybody can take alcohol for various reasons. And so I think that I've found like that doing the strong chamomile tea, specifically early on with the patient, can be a really good first step before doing some higher level interventions. But the tea bags themselves have other, so we talked about poultices, and you can basically use a chamomile tea bag as a really great poultice in some other applications. So they can be really good for styes. So if everyone had, although actually the best tea bag sty remedy is actually Lipton's Plain Jane Black Tea.
Are you serious?
Yeah, it's funny, like, because I belong to a couple of different naturopathic Facebook groups, and it's like so funny. Everyone like hands down says that like just like regular Lipton black tea, best for styes. So
there's always like a thing about turmeric.
and styes, I could see that, because it means very anti-inflammatory and also has antimicrobial properties. Yeah, you could also definitely use it. This could be another mastitis remedy easily. You can apply it to bug bites. You can apply it to sunburn. Obviously, you don't want it to be like boiling hot. You can even use it for hemorrhoids. There's a lot of interesting applications. So again, like if you have nothing, you're like in the wilderness and you just have a box of chamomile tea. There's a lot of things that you can do. Also, chamomile, again, because it is both carminative, bitter, and has antimicrobial properties, it's a really good when it comes to food poisoning. And so I should, maybe I'll put that in there as well. I have a really good electrolyte replacement recipe, specifically if somebody does have food poisoning, and you can add different herbs to it. And I think chamomile, so we might recommend like fennel or peppermint, but chamomile too would be a really good one as well to add. So it's just like a really good all-around herb and so easy to get. Okay, so lavender. So lavender is one of my like super favorite herbs, and probably the best way to use lavender is the essential oil, though you can actually, well, I'll talk about that in like a little bit when I get to like what you can use lavender for. So lavender has so many properties. It's anti-spasmodic, it's full spectrum antimicrobial. I know we think about it more for like sleep and anxiety and rest. It's very strong antifungal, antibacterial, antiviral, antiparasitic. So actually most of our essential oils have that property. Also very good for digestion. So it has all these different properties. So again, if we think about for relaxation, probably one of the best ways is inhalation, whether we put it in our bath, we can put it a few drops on our pillow. We can, if we, I don't know if there was a really nice line of essential oil products, and they were like, I don't know if anyone knows about like those Vicks pens, you know, I'm talking about the little, the inhaler thing. Well, they had them with essential oils, and they did have one like lavender and peppermint, because actually, we think a lot about peppermint when it comes to headaches, but lavender too can be very, very good when it comes to headaches and migraines. Though there are some people that do have intolerances to lavender, so it can also bring on migraines for some people. But if you do tolerate lavender, it could be really good for helping with headaches. Just inhalation.
Really?
Yeah. No.
My whole life, I need to take like medicine for my brain.
Yeah. So actually, it's interesting. I think, my next herb too is also migraine one too. So yeah, inhalation of lavender can really help with headaches. And that's why I feel like if you travel, lavender is just like a good essential oil to take with you, because it can help you feel calm and stuff like that. But then it can also help with these other issues. So the other interesting application of lavender is it can be very effective against cold sores. But there's a caveat. It only works if you apply it during what's called the prodrome phase. So the prodrome phase is like the tingling. If anyone has probably no one wants to say, I get cold sores because they're disgusting. But if you notice the tingling sensation of the cold sore, you know it's, yeah. So if you put a drop of that, it doesn't come. But you have to do it during the prodrome. You can just apply it. You can like just apply it neat to the cold sore, where the cold sore might happen, because it's not going to happen if you do it soon enough. You could actually mix, if you wanted to, you could mix it into like a carrier oil, something like jojoba oil or almond oil, but that can be very effective. It can also be effective. So you can actually take, okay, I'm going to say this, but you got to be really careful. You can actually take lavender internally. If you do it, you just want to do 1 or 2 drops, and it has to be really lavender. So that's one. I actually have a whole presentation all about essential oils and like what's good and what's bad and what to look for. So you have to make sure that it is 100%. If you are going to take lavender internally, you want to make sure that it's 100% certified that it is lavender oil and it's not mixed with something else, because that could be a disaster. But one of the amazing things, again, how I was saying, it has such like strong antimicrobial properties. Similarly, if you're somebody who's very in tune with your body and you kind of like, I don't know, when I get sick, it always first starts, I always get more like muscle weakness or muscle pain. That's like where I get it. Everyone has like their like little, I feel like everyone has like their first sign that they're coming down with something. If you take 1 or 2 drops of lavender oil at the first, it has to be like, again, it has to be like the first sign. It often, you won't get, like often it will just like kick it in. They also do sell encapsulated lavender oil, which can be used for a couple of different things. It can be really helpful for irritable bowel syndrome. It can be very helpful for stress and anxiety and sleep. So it can definitely be taken internally, but you have to, again, some brands that I know are definitely safe are Castor, which is found, I think, at Whole Foods, and you can buy that online. Simplers. But then again, like you want to make sure that if you are going to do it, you want to make sure that you're using 100% pure lavender essential oil, or you can always get an encapsulated product that you know is going to be safe. So ginger is another one of these herbs that most of us probably have encountered and we might have at home. And ginger has a lot of great properties. It's very anti-inflammatory. It's a very strong antioxidant. It's very good. It's probably something we all know about for things, any like GI upset, whether it's nausea, vomiting, diarrhea. It's really like has a lot of like very warming properties. The other thing that's also good for is actually headaches and migraines. In fact, actually, even research has supported the use of ginger when it comes to specifically migraine headaches. So typical dosage, depending if you're doing, so you can use fresh ginger. You can also, if you have like the culinary dried ginger. So typically, I would say about 1 to 2 tablespoons daily in a divided dose, whether you make it into a tea, or if you're doing the powdered ginger, that would be anywhere from like half a teaspoon to a teaspoon daily. Something kind of easy to do would be taking some honey, and you can mix the powdered ginger in the honey. And, you know, because ginger is pretty strong. And I also feel that ginger is like one of our best PMS remedies. Again, because if we think about like all the things that are not great about the bloating, cramps, also, even though yes, ginger, so ginger helps to inhibit platelet aggregation. So it does promote bleeding, but what's interesting is it actually can facilitate less painful periods because it does that. So if anyone has experienced like, at least I hear my patients like complaining about like having like a lot of like clots when they bleed. And so ginger really helps to like prevent a lot of like the pelvic stagnation. So that's another reason why it's actually going to help with pain. And even though, yes, it does have blood thinning properties, it does tend to actually lighten periods. And it's actually one of cinnamon can be very, very helpful when it comes to very heavy periods. I mean, it's not everything, but again, like when you really have nothing, you have nothing to try. I think it's definitely worth trying.
So every day is not too much.
Huh?
Take everyday ginger is not too much.
Oh, is it too much? Again, it's one of those things. I guess it depends how much you're using. Somebody was telling me, I was at some party. People always like to stump the naturopath, and they were saying something about like, I don't know if there was some study that came out, something about like some danger around ginger, but I don't know. I don't think there was anything to it. I think he was just trying to.
And then it juiced.
You could definitely juiced. Yeah, I love doing like the best. So it's interesting. So turmeric and ginger are actually in the same family. So if anyone's ever seen fresh turmeric, you're like, oh, it kind of looks like ginger. So they're the same. So that's a really powerhouse if you can get fresh turmeric and ginger and juice that. Yeah, whenever it's like that.
My kids love it. We call it the spicy juice.
Yeah.
Yeah.
And then if you throw
mix it with like apples or fruits and whatever.
Ginger or
Both. We do ginger and turmeric. They love it. I even make it
Yeah.
into ice pops.
oh, that sounds so
And
great.
they eat it in the summer.
Yeah, yeah. So that's like just a good thing definitely to have. Okay, so then the last, it's my last, yeah, it's my last herb. So garlic has, again, this is one of our super antimicrobial, again, against viruses and bacteria and parasites and fungus. And then it also very strong, like so I'd say like garlic has a couple of different functions. One, just like for general health, when we think of there's so many great studies supporting garlic with like diabetes, high lipids, aka high cholesterol, high blood pressure. So this is just like general health. But then the bigger application, I would say, just like for when if we're thinking more from like the topic of today's presentation, is really accessing its antibacterial properties and it's antimicrobial. Plus also it's a very great immune stimulant. So definitely something to add on, like if you are coming down with a cold or flu, really loading up on garlic, maybe, doing about 1 to 2 cloves a day. And the interesting thing, so again, how I said before earlier in the presentation, that garlic is related to onions, thank you, and that they operate a lot because of their sulfur compounds. So if you're also someone who finds garlic is too strong, you can also cook it, and that's not, so cooking the garlic does not diminish any of its healing properties, just to let you know. Yeah, so you can, yeah, and actually, because if you roast it, it does kind of kill the pungentness to it and almost can make it a little bit sweet. Or if you've ever had the black garlic, I don't even know, I haven't seen that in a while. It's so good. You can also, so garlic kind of also like onion. So not only can you use it internally, but it also does have topical applications. The only problem is that you smell like garlic. So if we're thinking about another, for example, another ear infection remedy is you can make a garlic with a garlic oil by just taking olive oil and mashing the garlic, and you can apply drops to the ear. You can apply to like a fungal infection. And then the last one that we often, so it can be used for vaginal infections. And one of the most famous applications, so group B strep, which I forget how much of the population has it, but it's a bacteria that if you are pregnant and you are about to give birth, if you have group B strep present, they are going to give you antibiotics. And of course, like there's definitely, yeah, of course, depends where. Yes, thank you. I forgot where I'm at. Yeah. But so doing what we call like a garlic tampon can be often very effective in eliminating group B strep. And basically what that works is you cut the clove, and you want to put like a piece of like dental floss, or some people, I've never done it that way, but I was just reading someone saying about like, putting it in a cheesecloth, but I feel like that's just too much to put up there. I'd rather just put the garlic clove, but that can be also a very effective way. Although I find like that you have to also, there's some specific strains of probiotic that also I would also recommend at the same time to build up the.
Just put a piece of garlic unwrapped.
Yeah. So usually we'll have the patient put it in at night and then remove it in the morning, and we'll usually have them repeat until they're going to get retested.
And then just boost your probiotic intake, because it also it can wipe out
Yes. Yeah.
all the other good bacteria as well.
Right.
So you
So
want to boost the good bacteria.
exactly. So usually what I'll have the woman do is she'll insert the garlic clove at night. And then there's one type that I will have her take orally. And then one type of, one probiotic I'll have her take orally. And then one probiotic that she'll take vaginally. Yeah. Okay. So that was the presentation. And if you have any, I don't know if we have time for questions, or also again, like if you want the whole, like all the how-tos, all the remedies, you can you can just send me an email and I'll make sure that you get everything you need.
Could someone take a picture and send it to the group?
Or also I have cards here if that's
Oh,
easier too.
yeah.
I don't know. Sorry, I just realized.
Do you have a practice in the
So a couple of things. So I used to have an office in the West Village and I closed it during the pandemic, but I now see patients from home, but not in my home, but I'm at home while I'm seeing them. Or they're sometimes in Miami.
Oh, it's amazing. Good for
Yes.
you.
Yeah.
Okay.
Yeah.
Any other
Yeah.
questions? I think we have a question. Like
Should you check for type B strep?
So group B
Sorry.
strep. So typically most of, right, sure.
Is that, so like, what does that mean? Is that like strep, or like, how do you?
It is strep. It is a type of strep. So basically in adults, it doesn't really cause any issue. It really only causes potential, even though I feel like, I don't know, to be honest, I feel like it's such a debate, whatever.
Yes, I was gonna say,
Because-
there's two sides of this coin. I just want to say that there are some providers that can give an option to not check if you'd rather not check. Some providers, even if you do check and you come out positive, can give you the option whether you want it or you don't want it. Like
Right,
antibiotics.
yeah. Yeah, because it's just increased. It's again, like if you didn't treat it and you gave birth, it's not a death sentence to your baby.
No.
Yeah, there is always a potential, but then one could argue, is not having any of your healthy flora on your baby. I heard this one microbiologist speak a few years ago, and he was talking about that if his son if his wife had to have a C-section, he would have like bathed his baby in like vaginal secretions or something just to get all her good flora that he was like missing.
Yep. Okay, so let's rewind.
Sorry.
Let me explain a little bit. And I think for anyone who's been here for previous talks, we've had different midwives and different people speak. As a baby is coming out vaginally, so the good bacteria that is inside of us in our vagina is coming on the baby, and that gives the baby the immune system, and it builds up all of
And
their
vitamin
good,
K.
vitamin K, all of their good. It's basically very, very beneficial for baby to go through that process. One second, hold 1 second.
Giving birth to
One
a
second, 1
baby.
second.
One step at a
So,
time.
so
Giving birth
in
to a
there,
baby
there
is-
are lots of different types of bacteria. Most of them are good bacteria. Sometimes there's extra that overgrew called strep B, and there can be a danger to the baby if the baby contracts it through that process and then gets sick. That said, the way I was taught and the way we looked at it was statistically,
Right.
the benefits of going through and still having that good bacteria as opposed to the cons of taking antibiotics, wiping out all of that good bacteria, and then the baby doesn't get any of it because it killed everything. Because you can't choose to kill certain ones and keep the other ones.
Yeah,
You
that's
either
the
wipe
big
everything
problem.
out, or you have everything else. So some people choose not to if their provider lets. So that's a different story. And then you can have the positives of the good, and then you can also monitor your baby, and you can do all these things such as like the garlic, or you can boost your probiotic intake in other ways. That way you have healthy, a majority of healthy bacteria, et cetera, et cetera.
Mhm.
That makes sense.
Yeah, exactly. Yeah.
Just to explain it.
Yes, yes.
Is there anything for postnasal drip?
Oh, postnasal drip?
Like to the point that your throat hurts because it's like, you know, different.
Yeah, so I'd say so. There's a couple of things with that. Is it this is where like I have like so one of the hard things with the naturopathic brain is I'm like, where is the postnasal drip coming from? And like so I need to know, like because postnasal drip is it like allergy in origin? Is it a cold or flu bacterial in origin? Is it acid reflux? So kind of like a lot of these are things that I might be think about.
Can I also mention,
Sure.
the beauty in your work is that it's generally, it's not about just treating the symptom. And I feel like a lot of the times it's like, okay, I have a headache, let's take a Tylenol, I'm just gonna treat the symptom. But in naturopathic work, the mindset is let's find the source,
Right.
let's find it at the source, fix that source, and then all the symptoms will go away. So it's like a whole different mindset. And I think that's why she's saying that, like, it kind of depends on where it's coming from. I mean, I'm sure you
Yeah,
can come
yeah.
up with solutions
Right.
for like, okay, do this, take that, but like, if you're not treating the source, so then it's gonna keep coming up. Does that make sense?
Exactly. Yeah. Yeah.
So what's the solution? Let's take this and that.
Do you know if you have allergies?
I think I took allergy medicine, it didn't help, but I don't know.
Or do you know what your allergies are?
Probably dust, mold, and everything else.
Okay.
There's a basement with New York mold, probably.
Well, I'd say like if I was going to say anything, so if I knew for a fact that it was allergy in origin, probably my go-tos would be NAC and acetylcysteine, which is actually just one of my favorite nutrients. It has a lot of different applications. So that would be one in particular, because I was thinking, because like that would help with the allergy aspect, but it also is very effective when it comes to one, thinning of mucus, and it's also very helpful for any kind of like sinus congestion or sinusitis. That combined with quercetin, and I'd say vitamin C would be. And then the other thing I would also just like consider too, like if you were my patient, would be when we think about like your environment. So like, what is your environment like? So often we don't realize how often we actually do need to change like our bed linens or and even our pillows. Like there's some like, I forget, like some kind of crazy statistic that like after a year that your pillow is like more than half dust, like the weight of your pillow is mostly dust mites. So just like some things to think of. Yeah. Right. Or then if like some of us live in like basement apartments, we definitely want to consider things like mold, especially if we have like a mold sensitivity. So these are also other things definitely. There's a lot of little factors that come into it. No. Well, you did see the accumulation. Right. Yeah. Yeah.
Does anybody else have questions? Any other questions? So we can contact you through these.
Yes. Yes.
And
You can also take a
appointments.
card too, Easy.
Yay, thank you so
Thank you. It's fun.
much.
Thank you
Yeah.
so much.
I'm glad this worked out. Okay. I'm gonna stop now here. One second. Hold on. Oh, 1 second. Can I add these in? Sore throat verdict doesn't go. Okay. Just on the phone. Did you speak about oregano oil?
Oh.
What about aloe vera?
Aloe vera. Actually, aloe vera has a lot of good applications, both aloe juice and yeah, definitely for wounds, sunburns. Aloe juice is probably one of my favorite acid reflux recommendations. Whether you take you take it, like cut it with some water, but usually I typically will recommend 4 ounces 2 to 3 times a day, and that can really help.
Are people who are allergic to summer flowers, pollen, and things like that possible allergic to chamomile as well? So
Oh.
it's a flower.
Yeah, mostly.
Yes.
Yeah, that's definitely possible.
Where can you buy mustard packets? Mustard powder? Okay, we discussed that.
Yeah.
And her email. Okay, we got it. We covered. Yay, thank you so much. Let me, there we go.